This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
We'll move on to University of Pittsburgh. And we have a whole roster with us tonight. We have Dr. Helkowski, who's the program director, Dr. Ram, who's an academic chief resident there, Dr. Cromer, who's admin chief resident, as well as Dr. Glicksman, who's another admin chief resident. You guys can take it away.
All right, well, thank you very much. I am Wendy Helkowski. I'm the residency program director for the UPMC PM&R program in Pittsburgh. And I just wanted to give a big thanks to the PM&R Scholars to allow us to present our program. I am thrilled to have all three of our chief residents who are brand new PGY4s who are going to be really taking the lead in presenting a bunch of information about our program. I'm going to hang out and listen, but I'll also monitor the chat. So if anybody has any questions as we go along, feel free to type those in the chat as well. And I'm going to let George take things away.
All right. Can everybody hear me?
Again,
thank you so much for awesome. Thank you so much for having us. It's awesome to see this event still thriving. So I'll just get started here. Again, I'm George. I'm one of the I'm our academic chief resident. So this is our crew. You'll be seeing a lot of pictures of our residents throughout this talk. We do get together very frequently. We made a program overview. I'll make sure that I share this in the chat when I'm done talking here. You could scan this QR code. It should pull the PDF up right for you. This is just going to have some additional details about our program. So just from a kind of large scope picture, numbers don't always tell the whole story. Rankings don't always tell the whole story. But I think this just does give a kind of an overall picture of how well-rounded our department is. We are currently number 3 in NIH funding for PM&R departments for research. We're number 4, the number 4 residency according to Doximity, and the number 7 best rehabilitation hospital for inpatient as per US News. It's our program leadership. As you can tell, we have some really strong female physician leadership from our chair to all of our program directors. Dr. Helkowski is an incredible program director. She's very, very supportive, both in your personal and professional lives. And our associate and assistant PTs are also awesome. And obviously, Dr. So is an absolute powerhouse in the field. So she's an awesome resource for us all. We have 9 residents per year. We have 5 categorical residents that do their intern year at UPMC Mercy. Both myself and Mike did that. Haley did the advanced resident option, which is 4 residents that come and join us their PGY2 year after doing their PGY1 year somewhere else. So there's flexible options for everybody, whether you want to be in Pittsburgh all 4 years or whether you want to start your academic journey somewhere else and then join later on. But there is also 2 transitional year spots available through UPMC Presbyterian as well. So my intern year, 8 out of the 9 residents were in the greater Pittsburgh area, which was really nice. We were able to get real close early on. Our rotation overview. So if you look at that document that I'm going to send you all, and with that QR code, it will break down the rotation schedule much more discreetly. But as you can see, kind of starting from PGY1, it's kind of the normal PGY1 year, a lot of medicine, some ICU, some nights. But then PGY2 year on, you have decreasing amounts of inpatient burden with increasing amounts of outpatient and electives. It's very well-rounded. You do start outpatient rotations early on PGY2 year. Today was our first day with our PGY2 residents out and about. on their rotations, and some of them were already, working on the outpatient side today and doing, procedures and all those things, starting on the first day of PGY 2 year. So it's an awesome opportunity to get acquainted with the outpatient side early on. These are our main rotation locations. So this is a map of Pittsburgh. And when you hear people talk about Pittsburgh, they'll talk about between the rivers. It is the three rivers that come together. I'm sure you've seen the awesome shots when you're watching the Steelers games in Heinz Field, kind of from the blimp of Pittsburgh. But UPMC Mercy and UPMC Presbyterian are kind of right within that downtown area. The Mercy Pavilion is this new structure that was just built that houses some of our inpatient research endeavors, and then the UPMC Presbyterian, Montefiore, and the Coffin Building is where a lot of our both inpatient and outpatient are. Most of our inpatient beds are at UPMC Mercy, and they're within a 7-minute drive of each other, so very close together. We have some other rotation sites that we go to throughout our time at the program. Some of them are a little bit further north, but the furthest you have to drive is about a half hour. It's not too bad. And our residents do live all over the city, either downtown, between the rivers. Some of our residents live a little bit north of the city, and some of them live in what's called the South Hills. And we'll be talking a little bit more about kind of the different living situations later on. But we do rotate at the Lemieux Sports Complex, Passivant Hospital, the Passivant Spine Center, St. Margaret's Hospital, the Freddie Fu Sports Center, and a few other sites in downtown as well. And I'm going to pass it off to Haley to talk about the inpatient experience a bit.
Yeah. So hi, and I'm Haley, again, one of the newly inducted fours, and one of the admin chiefs. So to go over, I know George kind of talked a little bit about, just how well-rounded our program really is. We have inpatient units specifically for stroke, spinal cord injury, brain injury, including locked units for traumatic brain injury. We do see disorders of consciousness patients on our traumatic brain injury, which I think is one really unique aspect. We also have a medically complex unit. As noted here, we have the second highest level of medical complexity in the US for a rehab unit. And that kind of spans all of our units, but notably one of our units, because we are a very large transplant and cardiac center, we do get a lot of patients who are so I suppose like an LVAD or transplants, and they come to our rehab unit. So you see really a lot on our rehab units, and you are really prepared for any direction that you want to go after residency from the rigor of our inpatient experiences. So moving on, kind of our outpatient experiences, again, a lot of diverse and unique opportunities. We do have a lot of exposure to kind of just a general rehab, MSK integration of ultrasound. A lot of our sports and spines physicians are utilizing ultrasound, which is a great learning opportunity. In addition, we are fortunate to have Dr. Munin. I just have to point out specifically because we have been exposed to neuromuscular ultrasound, integrating that into EMG and spasticity management. So you really see everything, kind of the bread and butter of rehab, and then also things that are on the front line. And also, one note is that you will get exposure early on in training to procedures. So it's not like something you have to wait till 4th year to get your hands on an ultrasound or to do spine procedures. You will start some of that advanced procedural training early on in PGY 2 year. And then also just a nice note that we do have various outpatient experiences in different types of settings. So you'll see the private model, the VA model, in addition to the academic, UPMC facilities. So regarding our education, we do have 5 hours of completely protected time. So our pagers are off. We are not responsible for anything on our inpatient units. And that occurs every Wednesday from 7 to noon. We do also get some lunch with that, which is always a nice treat. But our didactics are really, it's a nice balance of lecture-based education, with an emphasis on board related topics, but we also have a lot of hands-on experience with active workshops. One thing that's really unique about our program is we have a cadaver anatomy workshop, which goes on every year. We do anatomy, and we have the opportunity to also practice injections and ultrasound skills utilizing the cadavers. As shown here in these pictures, you'll see that we do a spasticity workshop, which I think we're trying to do every year now, because it's a really fun and helpful workshop. We get to work with our own attendings that we get to, work with in clinic. And then we also have no, I don't want to say vendors. Oh, what am I trying to say? The different, oh goodness, what is the term I'm trying to think? What's
The
that?
reps.
Yeah,
The reps
reps.
from
Oh
different
goodness.
companies.
Like, what is the word I'm trying to think of? But the reps for toxin, so that they can really help us out with like dosing and such. So it's a good like collaborative experience. And then we also get to do some off-site workshops. We get to visit some of the prosthetics orthotics companies in the Pittsburgh region, and they go through the whole process of constructing a prosthesis. So really great learning opportunities. One awesome perk of our program is we do have home call. Call starts off heavier in your PGY 2 and 3 year, but drastically goes down in the 4th year. But one great piece, which is unique to our program, is we do have a post-call half day. So a weekday, after being on call on a weekday, which would be an overnight call essentially from home, the following day you have a half day off because you were, a lot of times call is fairly light, but sometimes you can't have a busier night. So it's just a nice added perk that we have that additional time off to kind of get your sleep and an ode to wellness. We do attend many conferences. I think we had like 16 residents at AAP last year. So we all get really excited about conference time. Our program does give us fairly generous conference funds specifically to support us going and presenting work. Our attendings are all really involved in publishing and getting their work out there as well. So many opportunities to share and get involved in work. We take mentorship to a UPMC, very seriously, but also have a lot of fun with it. We really value, I would say, mentorship from a peer level and also from a faculty level. So all residents are paired as a PGY 2, you're paired with a 3 and a 4, based on clinical interests and then also personal interests and background. Also, residents will all have a faculty mentor. And it's noted here, we have a huge alumni network of mentors. Each year, as our 4s graduate, they stay in touch with us. I think it's just a really great culture of staying in touch and looking out for those who are to graduate in the future, making those connections. So we do have a lot of opportunities to kind of make your residency experience unique to your specific interests. So we do have a lot of elective time. If you do your PGY 1 year with UPMC in the categorical program, you do have 2.5 months of elective time. And then as a 4, you have 3 months of elective time. So you can really kind of focus on what area you're you have strong interest in. Another unique piece to our program is our senior clinic, which occurs in the 4th year. This is a half day per week during the 4th year that you go to any clinic of your choosing. A lot of residents choose procedural based clinics to work on their procedure skills, but it's really whatever you have specific interest in. And that's kind of our closest to like a continuity clinic, and continuity meaning like you have that one-on-one experience with an attending. We also have program tracks, and these are the 3 that are currently established: research, admin, and education track. Each of these involves protected time within your rotations. The research track is a little more involved. Definitely it requires, I think, the most time out of all tracks. And you do have the opportunity to join RMSTP. But with the admin education track, these are very much integrated into your curriculum. It's not a huge time commitment, but really valuable. Then coming soon, it's not established yet as a track, but we're hopeful in the coming year or so that we will have a track for lifestyle medicine, which is additional training and as a kind of let's do lifestyle medicine in terms of diet, exercise, all of these preventative ways that we can improve healthcare moving forward, and I think really aligns with rehab. So at UPMC, we do have many fellowship opportunities, and actually this year we have one of our recent grads staying on as our sports med fellow. But we do have, so ACGME accredited, we have spinal cord, brain injury, pediatrics, and sports. And then non-ACGME accredited, we have the value-based MSK spine care fellowship, and then pain medicine, which is through our Department of Anesthesia. And here's just kind of an overview of where our residents have gone in recent years. Here you can see it's really a balance, I feel, from for where our residents go, whether it's straight into practice, and even from there, you see a nice balance of residents going into private practice groups versus going into academic practice. And then a fair amount as well going into fellowship, and pretty diverse fellowship interests that are typically within each class. Right, and I think at this time I'm going to be passing over to Mike.
Yeah, thanks, Haley. So my name is Mike. I'm also one of the admin chiefs, along with Haley. So I've been given kind of the impossible task to tell you all the things that we love about our program, outside of the rotations and outside of some of the faculty and things like that, that George and Haley have already described just over a few minutes. But certainly feel free, like you can, to reach out to us at any point in time. I think Dr. Helkowski put our emails in the chat. You should have some email information on the program as well, in case you have any questions. But we have, I think, a ton of really great and really unique perks here at UPMC, from the free health insurance that we get to a meal stipend that's actually not necessarily a meal card, but something that you can use. Let's say if you're going to go grocery shopping and you want to meal prep yourself, I think it's really advantageous that way. We get, I think, very generous funding for conferences that has allowed us to go to various conferences, as well as educational funds in addition to that, that you can either use for conferences or board review courses or other things, whether it be scrubs or different training materials, textbooks that you think would be beneficial throughout the year. At all of our sites, we have free parking that's reimbursed by UPMC. I think it's a very affordable cost of living, very, very flexible vacation policy. I think a lot of us would agree with that. And then also there's a daycare right here at Mercy that those are parents in our program use. We also have a strong emphasis on wellness here. I don't think I would even be able to shed a light on how much I think we do together as a class and as a residency. One of the things that I think is really unique is the vertical events that we do. You see that in the bottom left corner there of the screen. Essentially, this is where people who are, PGY1, but mainly kind of the PGY2s, all the way up through the attending level, fellows if they want to come as well, will participate. So there we can see some of our crew playing some laser tag there. In the top right, we can see us, the Chiefs, and the new PGY2s went to a Pirates game. In the bottom, they do like these team at the end of the rotation at one of our ABI and TBI brain dinners, which is really cool too. There's mentorship meals where we get the chance to go over to an attending's house and have dinner there. And so some really, really great opportunities. We also get meant to touch on this. We also get an additional wellness day, which you can break up into half days over the course of the year, which I also think is really unique. Regarding our volunteering, I don't think I have enough time to kind of go into all of these, but again, we get the opportunity to volunteer at Birmingham Free Clinic. We get the opportunity to do some street medicine as well, and participate in sports. Here you can see us participating in some of the sled hockey and taking care of them, as well as in the some of like the adaptive sports involved in the Pittsburgh Marathon. We also have a endless supply, or at least it seems that way, of sports coverage opportunities, including some really cool ones. So we get the chance to participate in Division I sports at Duquesne University and RMU, which are nearby, as well as all the activities you see listed below that. I think what's really cool too is it's not like you're just kind of standing there in shadowing, but you're taking an active role, and there's a really kind of dedicated, I think, or intentional to give you that autonomy while also providing you the right amount of supervision throughout all these events as well.
So I think unfortunately we're out of time. Zach just notified me, but I'll just plug real quick. We're from all over the place. We're not just from Pittsburgh, and Pittsburgh is an incredible city where you can live in any type of living situation you want, whether you need a house in the suburbs, whether you want a fancy apartment with a pool downtown. It's all available to you with a lot of really fun things to do around. And I'll just make sure that the recording captures all these slides so you can go back and check these out. And then again, you have our contact information in the chat. There's also just the UPMC PM&R Chiefs Gmail, and then a lot of those program highlights are listed on that flyer there. If you have any questions throughout the entire process, please reach out to any of us. We're more than happy to take a minute to chat and tell you why Pittsburgh and the UPMC program are so awesome.